Okay, this is Team 6 working on social distancing in market areas. The case of young women and girls in vegetable vendors in Addis Ababa, Ethiopia. Before we go into the main issue, let's have an overview of COVID in Ethiopia. On March 13th, the first case was introduced. Following that, different restrictions were introduced. The major one on April 8th, where a state of emergency was declared. Currently, we are on phase 3, where restrictions are being lifted and some measures also reintroduced. We are contemplating of opening schools in November. Looking at the focus of our intervention, we'll be focusing on young women and girls selling vegetables in the different vegetable markets across Addis Ababa. Why this group of women? Because most women are engaged in the informal sector. These women are unskilled and uneducated and lack protective mechanism. They are also disproportionately affected by COVID. So the objective of our intervention is to improve social distancing in market areas and also to support the capacity of these young women and girls operate in a safe environment. To understand social distancing, we developed this systems map. The systems map explains what influences social distancing and also what behaviors affect social distancing. In our case, at the personal level, the age, the gender, the education level, and others affect the ability of these young women and girls to influence social distancing or to abide by it. So at the economic, their livelihood and their living condition also play a crucial role. At the social level, the social cultural norms also affect their behavior. So we'll be focusing throughout the intervention in these main areas.
When understanding our systems map, we looked at several factors, but we wanted to focus on 3 leverage points. And these leverage points were the personal, the economic, and social-cultural factors. When looking at these leverage points, we had to understand, one, these young women and girls, their personal, their economic, and social cultural factors, and how those influence their behaviors. And it was important for us to address our intervention around these leverage points. When we were understanding what model we wanted to focus on, we looked at 2 behavioral models. The first one was the extended processing model. And this model helped us guide our intervention to address these physical and social distancing. This model helped us understand the young women and girls' behaviors and how they specifically look at physical and social distancing amongst their daily lives, but also while they are in the market. There are 2 threats that we looked at and how these young women and girls have to balance these 2 threats. One of them is they're losing their livelihood, and also the other is their health. We wanted to look at these young women and girls because they were more worried about their livelihood and losing their livelihood over their health. Because of that, their perceived efficacy is low, and they engage in market risks. The parallel process model helped us understand how that fear of losing the livelihood surpassed the fear of contracting COVID-19 and helped us develop an intervention that would result in making sure and helping these young women maintain social or physical distancing of 6 feet.
So the socio-ecological model also explains the factors that influence the young women and girls' behavior at different levels, including personal decisions, social, cultural, and community environments. So to simply ask the young women and girls to physical social distance is unrealistic because the nature of vegetable trading involves unorganized environments with lots of pedestrian traffic. So at a personal level, these young women and girls prioritize sustaining their livelihood over their health. And as a result, they have to adapt to customers when they decide to physical distance or not, out of fear of retaliation or losing business when enforcing the distancing. So the livelihood of young women and girls is affected by physical social distancing, and in market settings, in order to achieve this goal, we require group action. So we plan to combine the individual, interpersonal, and social cultural levels to help us improve and sustain the livelihood of young women and girls.
So what are our strategies? Our strategies by and large focus on informing, consulting, involving, collaborating, and empowering, and then keeping that circle. When we look at our interventions at the personal level, we plan on organizing capacity building events for the young women groups, for the market security groups, community members, and administration. At the public level, which is mostly the market, we plan on doing awareness raising using public messaging, billboards, and other methods. At the community level, we want to strengthen community engagement by sponsoring traditional events such as the coffee ceremony, the ECO meeting, which are the traditional saving and credit associations, and also inviting role models.
So to do our intervention, we are seeing some challenges in these areas. At the personal level, we have non-compliance of physical social distancing between customers and sellers. There's also misinformation and misunderstanding and little support to reinforce physical distancing due to these women's position in society. So these women are also at risk of experiencing gender and sexual violence, and they lack the networks and support systems to help them socially and economically deal with physical distancing and to enforce it to protect their livelihood and their health.
To help us perform our interventions, we have instituted monitoring and evaluation throughout the course of our intervention. We start by conducting preliminary assessment and following revision of our intervention and then implementation. For each set of activities, we have identified potential indicators. When we look at our plan of action, as mentioned earlier, we will start by conducting preliminary assessment and then follow it up with revising our programs, conducting our intervention, and following it through final monitoring and evaluation. The time frame allocated is minimum 1 week for the assessment and the maximum 1 year for community engagement. The overall estimated budget is $94,100.
And we are already seeing unintended positive consequences from our intervention, which include facilitating the protection of young women and girls in their working environment, providing skilled training to improve both their health and their safety and sustain their livelihoods. And we also see that we can improve hygiene and sanitation in markets and replicate this intervention across the country. So we have different partners that we've identified, both at the government level, international, and community, which include the ECOP groups, the Ethiopian Red Cross, UNICEF, and the World Health Organization, among many others.
In conclusion, we wanted to make sure that our intervention not only is accessible for these young women and girls, but it's sustainable, and that we can help improve the self-efficacy of these young women and girls while they go into the market, they sustain their livelihood, but they continue to be safe and build trust among each other and a peer network support group that will encourage them to continue to make sure they physical and social distance within 6 feet, but also they continue to have this peer network support group even after COVID is done. Thank you.